What about the impact we can expect on healthcare stocks as all these provisions go into effect? We're going to talk about that right now with Les Funtleyder, a healthcare analyst with Miller Tabak. Based on data compiled by our company, his recommendations on healthcare giant Novartis have produced the highest rate of return of any analyst. Also an author of Healthcare Investing, Profiting from the New World of Pharma, from Biotech and Healthcare Services. He joins us now to discuss the changes which we're going to see tomorrow, but actually we're going to see a much more significant change come 2014.
That's correct. I mean, the changes tomorrow are, at least from a company point of view, somewhat window dressing. I mean, you heard Ms. O'Leary say, a lot of companies are just pulling out of the markets where they can't make any money, and that's children. So, there are ways managed care is dealing with this. I just want to make a final point. We've seen a correlation between, Republican pickups in the House and the Senate and share price performance for healthcare stocks in the past. And we would expect, if that was to happen, we would see healthcare stocks go up all across the board.
So you're closely watching what's going to happen on the 2nd of November.
Absolutely. And I think actually stocks will start to anticipate as we get a little bit closer to the election.
When we're looking at the stocks for the drug companies, how are they positioned when you compare what could happen for publicly traded hospital companies and corporations?
Well, with respect to the hospitals, it's less of a material thing from reform. The problems we're seeing with hospitals are the economy has forced people to put off elective surgery, and when they did show up at the hospital, being unable to pay their bills. And so volumes and pricing have been off, so those are likely to be weak. Now, longer term, and by that I mean 2014 when everybody gets insurance, they should see an improvement in that, probably by about 10%.
When we're looking back to medications, though, what changes will we see when a medication goes off patent? Will we see changes with more people skewing towards the generics versus going to the name brands?
Well, that's been for a while now, and obviously everybody wants a bargain. I'd say next year, with reform, the key is that drug companies are going to start paying into a fund to cover the donut hole for Medicare, which is a big deal for Medicare recipients, although in the grand scheme of things isn't really that big for the pharmaceutical companies. So we actually see more seniors using drugs because they're getting paid for now.
Okay. Well, if more seniors are using the drugs, perhaps even more people in general, if they do have the access to that, what are we going to see when it comes to changing profits? And also, what changes will we see with operations?
Well, it's hard to decompose what's happening from reform with what's happening with the companies in general. What's happening in general with the companies is that they've lost a lot of drugs to patent expiration, and now have to make it up somehow, and so they're digging into their operations trying to increase margins. Now, whether that's reform's fault or the fault of the fact that they can't get new drugs, that remains to be seen. But I'll say this: if somebody comes up with a cure for cancer, I think reform or not reform, people will take the drug.
Will there be any changes at all to R&D? How much funding is put forward to R&D?
As a function of reform, I'd say no. As a function of things like the R&D tax credit, which is, I think, a different law, different department, that may impact things somewhat. But R&D continues to be an important source of long-term gains, so they better do it.
So considering all the research you do, again, just kind of wrapping up the conversation the way we started, tomorrow's almost the dress rehearsal for what you'll be doing come 2013 and 2014?
Right. I'd say as the reform issues become implemented, we'll start to factor them into our models in the stocks. And the stocks are already anticipating some of the things like the age of 26. So I expect that you won't see much reaction in the stock market tomorrow.
Okay. All right. Les Funtleyder, thank you.
Thank you.
Nice seeing you in person. Appreciate it.